Hi, my name is Kerri, and I am a senior at Eureka College. My study is called Experiences of Racial Discrimination and its Effects on Depression Rates in African American Women. My advisor for this study is Dr. Swan. This is my abstract. My study investigates the relationship between racial discriminatory events and depression rates in African American women. I used two structured questionnaires that were given to each participant via social media outlets. My analysis showed a significant correlation between events of discrimination and self-reported depression rates. I concluded that there is a relationship between the two and that there is more research needed in this area. So there were a couple different articles that I found that helped me do my research, and I'm going to go over a few of those with you. The first one by Carrington et al. Examined the difficulties to diagnose African American women. They said that treating women who suffered from racial discrimination could come with non-treatment because African American women do not often go in for treatment or diagnosis for depression. There could be misdiagnosis, underdiagnosis, and a lack of proper coping strategies given to these women. Another study by Arterian et al. Talked about stress-related factors and their association. This one talked a lot about how depression can be linked to eating less healthy foods, such as eating less vegetables and fruits. Another study by Miranda et al. Talked about the intersection between depression and drug/alcohol abuse. They did say that poor Black women living in America could increase depression as Black women show evidence of unmet needs. These unmet needs can lead to depression and the use of drugs and alcohol. Although drug and alcohol abuse was said to be low when accounting for all African American born women, it is still higher than their counterparts. Another study talked about better practices being available to psychologists so that those proper diagnosis strategies and coping strategies could be given to African American women. So these are some limitations that I found when I was looking through research. One article talked about how African American women do not often report depressive symptoms, so this can definitely be a factor in limiting what we can study. Another article by Brown et al. Examined the correlation between high levels of psychological distress and racial discrimination in African Americans, and it noted that cross-sectional data is overused. Another study talked about deterrence is needed to better understand race-related stressors. And then the last one talked about the need for more empirical-based research in this area. So this slide has both my null hypothesis and my alternative hypothesis that I'll be testing. My hypothesis was that experiences of racial discrimination within the last year will affect depression rates in African American women. And the alternative hypothesis is that experiences of racial discrimination within the last year will not affect depression rates in African American women. So for my study, I was able to get 105 females. Out of those females, I had 98 self-identified African American women, 6 self-identified multiracial women, and 1 self-identified biracial woman. The ages for my study was between 18 and 66. My study was available online via social media outlets, but I got a majority of my women from Facebook. The design for my study was to give out 2 questionnaires, which I offered via Facebook and other social media sites. The first questionnaire consisted of 8 questions. Those 8 questions asked about experiences of racial discrimination within the last 12 months, and they were rated on a 5-point measurement scale, which consisted of always, often, sometimes, seldom, and never. The second questionnaire consisted of 30 questions. Those questions asked about their feelings after experiencing a racial discriminatory event within 12 months. It also used a 5-point measurement scale as well, so that always, often, sometimes, seldom, and never. And all the responses for this are self-reported depression rates. So after gathering all of my data from my participants, I did perform a linear bivariate regression, and this chart here shows the mean and the standard deviation of that correlational analysis. So as you can see, I have a mean of 2.67 for discriminatory events, a mean of 2.48 for self-reported depression, and a mean of 35.89 for age. And I thought that mean for age was pretty amazing, since the range that I got from my participants was 18 to 66, and this was offered in Facebook and other media outlets. So I did construct this scatter plot for an easier view of where my participants did score on that 5-point scale of measurements. So 1 on this chart stands for never, and then of course the 5 being the highest is our always. And then on the bottom row we see here there are the number of participants, and it kind of stops a little bit after 100, meaning that I had 105 participants. And so everything that they answered, all of those are put on this scatter plot. So the gray ones are the way that they answered for experiences of discrimination, and for the darker gray dots, those are the self-reported depression symptoms. And as you can see, a lot of those dots kind of go towards the middle at the area where the 3 is, and that's the sometimes area, because that 3 for my 5-point scale stands for the sometimes. And then we have some that go all the way up closer to 5, which is always, and then ones that go closer to 1, which would be never. So from the graph and the table that you saw previously, I am going to put the results in simplistic terms. So after looking at all of the correlational analysis, as I hypothesized, the regression analysis did show that experiences of discrimination significantly predicted self-reported depression among African American women. And the regression analysis also showed that age, coupled with experiences of discrimination, significantly predicted self-reported depression among African American women. So from the data that I collected, coupling that with the table and the scatter plot that I showed previously, the results confirm how age predicts depression. Another factor that I noticed studies talked about was physical activity in adult population. A study concluded that lesser physical activities typically observed in older populations correlates to more depressive symptoms. And some studies show that increasing age in women also increases the lack of emotional support that they have. This could be if they lose a loved one or a significant other. This can therefore add on to depressive symptoms. For discrimination and depression, previous studies relate racial discrimination with higher chances of depression. Despite more education and higher socioeconomic status, treatment based on one's race continues to hinder African Americans from accessing more opportunities. It takes more effort for this group to progress in the social ladder, and this issue undermines their mental health status. Limitations to my study are the use of the correlational method and cross-sectional analysis. As I stated previously, a study did point out that this was being overused, and of course I used it as well. Another limitation is the use of an online questionnaire, as participants may not accurately answer the questions, or they may not give all the information needed for the questionnaire, and none of it can be verified. Another limitation is that I needed 779 participants in order to see an effect in the research. I was only able to get 105 participants for my study. Previous research has stated that more research is needed in this area, and I would also suggest the same. Despite the limitations that come with correlational methods and cross-sectional analysis, this study contributes to emphasizing how racial discriminatory events, as experienced across different age groups, negatively affect mental health in African American women. When African American women encounter racist incidents, it gives them a sense of defilement. Encounters like these impact an individual's personhood, and we have yet to determine how minor or major that impact may be. Considering factors specific to African American women will greatly help in formulating effective interventions for this population in the future. The study that I presented today adds on to the previous research in this area, and it also suggests that more research needs to be done, as there is more information and factors that can contribute to depression rates in African American women. So this is my reference list that I used for my study. And this is a continuation of that reference list. Thank you so much for sticking around and listening to my research study. I hope to hear from you in the Q&A session.